Hi everyone, my name is Alma Huerta and I'm going to be discussing Switzerland's healthcare system. So first I wanted to talk about the role that the government plays in the healthcare system, as they do play an important role. The duties of the healthcare system are split up between the federal, cantonal, and municipal levels of government. So Switzerland has cantons, which are subdivisions of a country. They have 26 of them. I included a map to give a visual of just exactly how these are split, and each one has their own constitution, so therefore they have their own responsibilities. These responsibilities include licensing providers, coordination of hospital services, and subsidizing institutions and individual premiums. The federal government regulates financing of the system, and this is mainly done through MHI, or mandatory health insurance. But they also have to ensure the quality and safety of pharmaceutical and medical devices. They oversee public health initiatives, and they promote research and training. Municipalities are responsible for long-term care and other social support groups. We have the Federal Health Insurance Law, which was introduced in 1996. This pretty much set the tone and the standard for health insurance and health care in Switzerland today. This law had three main objectives, which was to introduce universal coverage, ensure high standards of health services, and control and contain the growing costs of the healthcare system. It also helped promote strengthen equality by also introducing subsidies for low-income households. So as for the cost of health insurance, one must wonder if it's a universal. How does it work? But according to the World Health Organization in 2014, the total expenditure on health per capita was $6,468. Switzerland had a total expenditure of 11.7% of GDP on health insurance in 2014. Out-of-pocket payments also accounted for over a quarter of health spending, which is high compared to the OECD average of 19.5%. These out-of-pocket payments are mainly spent on things like dentistry, dental work, and long-term care, all which are not covered usually with the mandatory health insurance packages. And for further clarification, the OECD is the Organization for Economic Cooperation and Development. It has 36 countries as members, Switzerland of course being one of them, and it was created to stimulate economic progress and world trade. As for coverage, like I said, everyone must be covered. You must have health insurance in Switzerland. If you were not born there, but you moved there or you're staying there, long term, more than 3 months, you have to sign up for health insurance within 3 months of your arrival. It is absolutely mandatory. And we have the health insurance packages divided into two categories. You have sickness insurance and accident insurance. Sickness and basic health insurance are pretty much hand in hand. And they cover most general practitioner and specialist services. Here are a list of examples. So you have emergency treatment, prescription medications, pregnancy and maternity. We also have abortion covered, vaccinations, rehabilitation services for illness or after operations. And we also have outpatient treatment covered, contribution to transport and rescue expenses. And then we also have mental health and illness covered, but it's only covered if by certain physicians. There's screenings for early detection of disease among certain risk groups. We also have medical treatment on short trips of Switzerland covered, mainly in other EU countries. However, there is a cap on 90% of what it would cost in Switzerland. So you would have to pay the remaining 10%. Insurance coverage is not affected by health risk factors, which is great. We also have the quality. The quality of health insurance and the healthcare system in Switzerland has pretty good reviews. About 57% of patients were able to receive same-day or next-day appointments when sick in 2016. 58% of them reported that it was somewhat easy to get care after hours. 9% reported waiting 2 months or more for specialist appointment. 7% reported waiting 4 months or more for elective surgery, and 22% experienced an access barrier in 2016. This is defined as one or more of the following. They did not fill or script a prescription. They did not visit a doctor with a medical problem and did not get recommended care. These statistics are brought to you by the Access to Care in Switzerland, which was retrieved from the International Commonwealth Fund. So again, there's always that notion that universal healthcare coverage will make it harder for people to get care, will make their, especially like same day. As you can see, it can go either way. So for choice, everybody has a choice in Switzerland. Definitely have to choose, have to have healthcare. There's no choice in that, but we do have the choice to choose our health insurance company and plan. So they can choose their deductible rate. Usually, insurers must offer a minimum deductible rate of CHF 300 for adults and 0 deductible for children 18 and under, but one may choose to opt for a higher deductible and a lower premium. There are also managed care plans, MCPs, that are managed by a managed care organization. So these are designed to be cheaper insurance plans. However, it does reduce the patient's provider's choice to pre-approved funded practitioners. So you give and take a little bit there. And they are also given the choice to change insurance providers twice in 1 year. And that pretty much wraps it up. Here are the references. The end. Thank you so much.